Thanks, Mark. These are my disclosures. None. I'm going to talk about 4 broad topics, but I'm going to kind of go through the first 3 quickly because I have something exciting to show you at the end of this talk. So first, what I'm going to talk about is the questions that we get. I've been getting them for 15 years from our members at various times, but they're sort of the current things that we deal with. Brian covered the orphan designation issue. I would just add that, I think he touched on this, but I would just add that we completely believe that hemophilia is an orphan disease, and therefore manufacturers who are developing new therapies for it should get the advantages of orphan legislation, which means cheaper consultation with the regulators, and also the ability to do clinical trials with fewer patients because of the orphan status of the disease. But then, as Brian pointed out, we have no shortage of excellent treatment products, and so we don't believe that the market exclusivity part is important. Another thing that comes up again and again with products, and especially now that there are so many new products coming down the pipeline, is the issue of label indications. A perfect example of this is that most products today, in particular in Europe, are licensed for use in adults only, because European legislation requires that medicines be trialed in pediatric use, and you don't start doing a trial on children. So the fact is, a product like a Factor VIII product comes out and it says for adult use only. We know that in most of the world, hematologists think of Factor VIII as Factor VIII. They don't check the label, and they use it to treat children if that's the product they have in their fridge. That's not really a big concern for us, that pediatricians are avoiding or not reading the label. It is a concern for us, the delays that this causes for some of the companies getting their products onto the market. As David pointed out, inhibitors, when I started this work, we were really very much still about, there were supply issues with a plant being shut down for a while, and still a lot of worries about safety issues, including variant Creutzfeldt-Jakob disease. But we've really lately shifted to concern about inhibitors, which is, of course, the most serious adverse event related to using clotting factor concentrates. Over the past 5 years, there have been rumors circulating about particular products carrying higher risk. The most recent example of this, well, it's not a rumor, it's a published study suggesting that certain recombinant factors have higher risk than a certain type of plasma-derived factor that contains von Willebrand factor. That's really tricky for us because those recombinant factors are, something that we've been very supportive of for years. They're used all over the world, and the fact is that there are other recombinant factors that weren't involved in the study, and there are plasma-derived products that weren't involved in the study. So this a bit is it's concerning, but in the context of the not North America and not Europe, where often there is not a lot of product choice. The WFH is very clear that not treating is the worst choice. If you've only got a recombinant product in your fridge and you have a bleed to treat, you should treat it with that product. And it's the same with if you've only got plasma-derived. Not treating is the worst choice. So as you all know, there are a lot of new products coming out, and we do get a lot of questions about how that works. Basically, the manufacturers go to the 2 big agencies first to get approval, the FDA in the United States and the EMA in Europe. They have a different approach to how decisions are made. In Europe, there are, I think, 30 countries that participate. Something like 27 of them have a vote. Sometimes that process can take a little longer. The FDA, I think, is a little faster, but it's just one country. Most of the rest of the world accepts a license from either of those two agencies as good enough and will allow import of products that have EMA or FDA licenses without any further testing. The EMA has a system called the Plasma Master File system. This applies to products that are sold in Europe, and it doesn't matter where they're manufactured. If they're used by European patients and they're plasma-derived product, they have to be on the Plasma Master File. This is really just a set of records that describes the source of the plasma, the addresses of where it's collected, where it's stored, everything about the manufacturing of the plasma. And various European regulators, Germany, Spain, France, they take care of the Plasma Master File for different companies. The FDA doesn't use a Plasma Master File system. Canada doesn't use it. And although it's an excellent record-keeping system that the Europeans have used, I think, again, the WFH does not feel that it's essential in the rest of the world. It's a nice system they have in Europe, and I think it's very trustworthy, but it's not an essential part of product safety. I'd just like to plug Brian's Guide to National Tenders, which was recently updated. WFH does feel that national tenders are probably the best way to get a sufficient supply of product at good prices. So products that are not covered by the FDA and the EMA, as I said, most countries accept those two agencies, and they won't accept other products. That's unfortunate because there are a lot of products manufactured in the world to the same standards, but they just don't get the license from either of those agencies. One of the reasons is if you're not planning to sell your product in the US or Europe, it's a lot of extra money to get a license for access to a market that you don't plan to go into. And furthermore, getting EMA approval requires participating in a Plasma Master File. If you're not going to sell in Europe, you don't really need to do that. When I started working here, Albert Ferrugia wrote a guide for the assessment of clotting factor concentrates. It's really intended for regulators in the rest of the world. It explains the European and FDA systems, regulatory systems, and the idea of the guide is to show regulators in the rest of the world how you can assure safety of products without, without requiring FDA licensing. That's being updated this year. We hope to have the new version out by the end of the year. We put out statements on product selection, making exactly this point that well-manufactured products can be made all over the world, and explaining how you can assure that the products you're choosing are safe. One of the issues that we get that is quite frustrating because it happens again and again is regulators requiring end product testing for viruses. This is not something that you can do. You can't take a vial of factor VIII and test it for HIV. I've heard recently about a shipment of a recombinant clotting factor concentrate that was stopped at a border, and the regulators of the country that it was going to be shipped to required testing for HIV on a recombinant product, which is rather frustrating because, as you know, recombinant products are not made with human plasma. Okay. I hope JF is in the room. He helped with this. But in the late 90s, Dr. Carol Casper set up something called the Registry of Clotting Factor Concentrates. This was a list of all of the products that are available for export around the world. And when she started, it was plasma-derived products. So it included all the information about the donor screening, the donor testing, mini-pool testing, manufacturing steps, and activation steps. And also things like the potency of the products and amount of von Willebrand factor and things like that. Then when when recombinant products came onto the market, she added the recombinant products, and the registry now contains, lists all of the products that are available for export, as well as the rare factors, 10 and 13, things like that. The registry was a book full of tables, and to understand a product, this is the serologic testing table, this is the plasma inventory hold and NAT testing table, this is the sort of the manufacturing table. To understand one particular product or to compare two products, you would have to flip back and forth between these pages. So this is Hemate P, product that has been around for a long time. So you'd have to look at this row on one page, this row on another page, this row on another page to understand everything about the product that we had in the registry, which is obviously, confusing. So what we have done, and this is, it's available in beta form on our e-learning site now. So as I was saying, what this does is it gives you all of the information about the products that was in the registry in various different tables in one place. So it's just a lot easier to understand what you've got. But one of the nice features we have is that you can compare products. So if you have, this is obviously a plasma-derived being compared with a recombinant product, but you can do that. You can search by, let me see. You can search, by brand name. This is for all products, but you can also, limit it to, let's just say, hemophilia B, and it'll give you alphabetical by brand name. We also have the rare diseases, and we also have the ability, you can export the various windows, but I think most likely people would probably want to download the 3 products they were interested in and then have all the information there. One of the things that one of the complications we had is that some of these products are sold in so many different countries that they have rules about where they do the P24 antigen testing and where they don't have to. That, unfortunately, is something we're still working on, how to get that to show up in the printouts. But again, all the information that we had in multiple tables is now available in one. One table. We're still updating some of it, and one of the other things we're quite happy about is that as soon as products come on the market, we'll be able to add them here. Another thing is that if a manufacturer changes one little detail about their product, they have to wait 2 or 3 years for us to publish an updated registry. Now we'll be able to correct or to update those things immediately. Like maybe they change their pool size, or maybe they change the site of manufacture or something. We can make those changes instantly. So we hope that this will be as up to date as possible once we get out of the beta version.